Hi, we'll be talking about the antisecretory drug and mucosal protectant. Antisecretory drug is a drug that inhibits or lowers secretion rate of body secretion, mainly water and electrolyte, while mucosal protectant is a protective agent that provides protection to the mucosal lining of stomach by forming protective barrier between mucosa and the acid. Next, we move on to ranitidine, or more commercially recognized with Zantac. This is a drug that is used to reduce the amount of acid in the stomach by inhibiting the basal gastric acid secretion during daytime and nighttime. It helps in healing of the esophageal lining that is damaged by the stomach acid, and this is stimulated by the food intake betasol and pentagastrin. And this drug is usually used to treat condition of excessive acid production, for example, Zollinger-Ellison syndrome, which is due to duodenal and pancreatic tumor that secrete gastrin, and it comes with signs and symptoms such as abdominal pain, diarrhea, and heartburn.
For the mechanism of action, ranitidine hydrochloride is the active ingredient, which is a histamine H2 receptor antagonist, which means that it will compete against histamine to bind to the H2 receptor to prevent secretion of gastric acid by preventing transport of H plus ions out into the stomach. The binding is reversible. The following are some side effects and adverse effects. Adverse effects includes liver inflammation, and neurological function can also be affected. Some precautions to be taken when prescribing ranitidine includes considering other treatments that the patients might be undergoing, including delaverdine, which is a drug taken by HIV patients, which can be rendered ineffective when taken together with ranitidine. Patients should also be warned not to take multiple doses to catch up in case they missed any doses, because overdosing on ranitidine can cause hypotension and trouble walking. Contraindications of ranitidine include patients with liver disease, kidney disease, and porphyria.
Next, we proceed with omeprazole, which has been sold under the name of Losec and Filosec. Omeprazole is a drug that acts as a proton pump inhibitor and also an acid reducer. It helps to control the amount of hydrochloric acid in the stomach by cutting down the overproduction of acid by the parietal cell in the stomach lining. As for the signs and symptoms for acid reflux-related disease, the patient may have weight loss, nausea, abdominal pain, and also heartburn. This drug has been used nowadays to treat active benign gastric ulcer, erosive esophagitis, Helicobacter pylori infection, and also symptomatic gastroesophageal reflux disease, or known as GERD. As for the mechanism of action for this drug, the main point is omeprazole will specifically inhibit the hydrogen potassium ATPase enzyme system. The action of this drug will be triggered by the acidic environment in the stomach. Omeprazole will be absorbed into the bloodstream, and then it binds to the hydrogen potassium ATPase proton pump, which is located in the parietal cell of the stomach lining. Then, the omeprazole will inhibit the proton pump and reduce the output of hydrogen ion into the lumen, thus lower the production of hydrochloric acid in the stomach. Little amount of hydrochloric acid will remain in the lumen.
Common side effects usually occur are headache or abdominal pain. This medicine will increase the risk of having fracture of hip, wrist, and spine. It also can cause the rare effect, for example, liver damage, inflammation in the kidney, and pancreatitis. Omeprazole must not be used with medicine containing rilpivirine. Omeprazole can cause the severe type of allergic reaction and severe stomach condition when used with antibiotic. Prolonged taking of this medicine can make difficulty in absorption of vitamin B12, gland polyp, and abdominal tissue growth in stomach. Omeprazole can cause hypomagnesemia due to taking this medicine more than 1 year, or taking the medicine with digoxin or other diuretic medicine.
Okay, so what is sucralfate? So the generic name of sucralfate is sucralfate. The proprietary name is carafate, and also it is administered orally. Okay, so what is the general uses of sucralfate? Sucralfate is mainly used to treat peptic ulcers such as gastric ulcer and also duodenal ulcer. So the drugs acts by healing the ulcer. There are many signs and symptoms of the peptic ulcer, such as burning stomach pain, nausea, and also heartburn.
The mechanism of action of sucralfate starts within our stomach. It will be dissociated and bind to the ulcerated gastric mucosa. This will form a protective layer between the ulcer surface and also the gastric acid. This will inhibit the back diffusion of H+ into the gastric mucosa. Sucralfate also helps to increase the production of the prostaglandin and inhibit the secretion of the gastric acid by the parietal cells. So this will enhance the healing process of the stomach lining to avoid the ulcer from getting worse.
There are many side effects and adverse effects that the patient could experience after taking the drugs.
Lastly, the precautions and contraindication of sucralfate. First, this drug can cause allergic reaction as it may contain inactive ingredients. Second, the elderly people with the kidney problems tend to have high levels of aluminium, so they must avoid taking this drug along with the other drugs that contain aluminium. Also, patients with the respiratory complications such as cough reflex must take several special precautions while taking this drug orally.
Let's proceed to the Mucosal cycling. The use of this drug is for antisecretory, which is reduce the production of acid in the stomach, and also has an antimicrobial effect, which again the action of Helicobacter in the stomach. For the clinical manifestation, sometimes asymptomatic, especially in patients that use of NSAID, and in the other case, in patients having some symptoms like abdominal pain, discomfort, nausea, vomiting, and bloating, that can or patients that are affected by the peptic ulcer.
Okay, next we move to the mechanism of action of bismuth salicylate. Basically, this drug is taken by orally. So in the stomach, the drug will come in touch with the hydrochloric acid and form a soluble bismuth oxychloride and salicylic acid. By the influence of gastric pH, which is acidic, the salicylic acid salt will be taken up into the gastric mucus and bind to the protein at the base lining of the stomach to form a protective layer. So this layer will protect the gastric epithelial cells from the pepsin that can worsen the peptic ulcer. Other than that, this drug also can act as antibacterial, which will inhibit the synthesis of bacterial components and enzymes. Therefore, there is no bacterial growth can be occurred and will increase the mucus production to protect the epithelial lining. Alongside by the consuming this drug, there is also side effects which include the ringing and buzzing ears, black stool, nausea, and vomiting. The adverse effects also include the impairment of nervous system, which will cause anxiety, jerky movement, tremor, vertigo, and mental confusion. Prolonged consumption of this drug will cause renal failure and liver damage.
For the precaution, this drug is hypersensitive to bismuth, aspirin, and other cyclin, and this drug should not be used in a woman during lactation and pregnancy, and should be avoided from the pediatric patient, which is kids, and this drug can react with other medication like tetracycline antibiotic, preventing the drug from fully absorbed by the body.
Next is misoprostol. Misoprostol is an analog of prostaglandin, hence it will act by mimicking the effect of prostaglandin, which is to protect gastric mucosal layer from acid. Besides that, it also can cause abortion, induce labor, and treat postpartum hemorrhage. The indications for people taking misoprostol is people taking NSAIDs, because NSAIDs will lower the amount of prostaglandin produced in our body, and also for those osteoarthritis and rheumatoid arthritis patients, and also for smokers and alcoholics that tend to develop gastric ulcer. Misoprostol has a few mechanisms of action, and the first one is misoprostol will bind directly to the prostaglandin E1 receptor on the parietal cell and will inhibit the action of adenylate cyclase enzyme. The inhibition will reduce the concentration of intracellular central second messenger produced and will decrease the activity of luminal hydrogen potassium ATPase pump, and hence gastric acid secretion is inhibited.
For misoprostol would be how misoprostol exerts cytoprotective action on GIT mucosa. Misoprostol increase secretion of bicarbonate and stimulate mucus production. As more mucus is produced, mucosal bilayer thickens, and thus it promotes efficient aerobic metabolism and improve mucosal regeneration. Lastly, it prevents back diffuse hydrogen ion into gastric mucosa. There are some side effects of using misoprostol, which are diarrhea, stomach cramps, nausea, and vomiting, while adverse effects would be pyrexia or fever and shivering. Misoprostol is contraindicated for patients with hypersensitivity to prostaglandin and for pregnant women. In conclusion, antisecretory proprietary drug can lower secretion rate of body secretion such as gastric acid, while mucosal protectant can protect the mucosal lining of stomach from acidic gastric juice. There are references for you to refer. So that's all from us. Thank you.